Good afternoon and welcome to 30-Minute Thursdays. My name is Dr. Stephen McEnany and I'm an orthopedic surgeon at Hospital for Special Surgery. On today's webinar, we're going to talk about all about how to prevent injury while weight training, particularly avoiding back injuries. Our guests today are Dr. Alice Chin, a physiatrist at HSS Stanford, and Max Castro-Galeas, an exercise physiologist at HSS Westchester. Dr. Alice Chin is a physiatrist that treats disorders and injuries of the neck, back, muscles, and joints in a minimally invasive manner using techniques including epidural injections, blocks, medical acupuncture, and more. Max is an exercise physiologist at HSS in Manhattan and Westchester, New York. He is a certified strength and conditioning specialist and has worked with a diverse range of clientele across a variety of ages and skill level. So thank you all for joining us, and we'll get started with a few quick introduction slides to outline what we'll be talking about today, and then we'll move into some directed questions. So I'll start by briefly outlining some general spinal anatomy. We have a vertebral column which extends from the base of the skull down to the pelvis. We have 33 total vertebrae. Superiorly, we have 24 vertebrae, which are separated by discs at each level. So we have 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. At the bottom, we have our sacrum and coccyx, which form a fused bone. In general, within the spine, the vertebral body makes up the largest section of the vertebral column, and it increases in size as we move from the head down towards the feet, with the largest vertebra being in the lumbar spine. In general, throughout the spine, the vertebral bodies and the disc bear approximately 80% of the weight of the body throughout the spine, with 20% coming from the facet joints in the back. We have normal spinal curvatures, and sometimes when we have abnormalities in these curvatures, these can lead to pain. So in general, we have an S shape to the spinal column with cervical lordosis averaging about 30 degrees. So this is a backwards curvature. The thoracic spine curves forward. We call this kyphosis, and this is typically about 30 degrees. And then the normal lumbar lordosis is about 50 degrees with a range of 30 to 80 in most adults. So we have a process of disc degeneration. And so the discs in total make up about 25% of the height of the vertebral column. And it's the inner soft portion of the disc that can become dehydrated during the course of the day. And in fact, if you measure yourself in the morning versus at night, most people tend to be about 1 to 2 centimeters shorter at night than during the day. It's the actual aging process that we start to see some of these permanent dehydration changes that take place, most commonly between the ages of 40 to 60. And this is associated with decreased range of motion and can also result in narrowing of the intervertebral foramen, or the tunnel where the nerve exits the spinal canal and goes into the body. This is an example of the neural anatomy in the lumbar spine. As I was mentioning before, the neural foramen is the tube where the nerve exits. And so this is where you can have compression of the nerve, and we can see that here within the foramen, the nerve is exiting there, along with its associated arteries and veins. In addition, we have several layers of muscles throughout the back, 3 layers in general. We have a superficial, an intermediate, and a deep layer of muscles. In particular, for what we're discussing today in the lumbar spine, we have the thoracolumbar fascia and the major muscles of the superficial group, including the latissimus dorsi. Deep to these, we have the erector spinae group of muscles, and then we have the deep rotators of the spine. And all of these muscles can be involved in pathology and can be injured when not exercising appropriately in the gym. And finally, we have spinal ligaments. These are present throughout the spine from the base of the skull all the way down towards the sacrum. We have a ligament that exists in the front of the spine called the anterior longitudinal ligament. We have a ligament that forms the front border of the spinal canal called the posterior longitudinal ligament. And this is thick over the vertebral body, but as we move out to the sides, it becomes very, very thin. And it's this weak point in the ligament that can allow for a disc herniation to come out and compress a nerve. Finally, we have something called the ligamentum flavum or the yellow ligaments, and this forms the back border of the spinal canal. And this can become thickened with degeneration and can lead to conditions such as spinal stenosis.
So now that we've learned a little bit about the anatomy of the back, we want to think about how we use that anatomy lesson and how we move our body to our benefit, especially in sports and in our young athletes. And so for most athletes in the middle and high school and up age group, that means working a little bit in the weight room. And so really, what's the purpose of the weight room? We want to use the weight room because we want to strengthen the muscles. We want to strengthen those muscles because we want to prevent injury. We want to be better athletes. We want to have better performance. We have improved that endurance, and we want to prevent an injury. So the preparation that we do on the field and in the weight room is what allows us to perform at our peak as athletes. The weight room is not a place to show off. It's not a place to be thinking about too many other things other than the exercise that you're really supposed to be doing. So it's very important not to be too cavalier when you're in the weight room or be distracted. So common injuries of the back, most of the injuries are usually sprains and strains, and what that means is that the injury of those muscles, which is a sprain, or a strain, which is an injury of the ligaments, and we went over all the several muscles and the ligaments of the back. Those usually respond very quickly to ice and rest. So if your back is hurting, you want to lay off the weight room for a day or so. And that, if it's really just a back sprain, that should really only last a couple days or less. In our young athletes in particular, most athletes, most kids actually under the age of 20 should not have back pain on a regular basis. It's not normal to have back pain. And so really, if you have a young person who has some back pain and they've been complaining of back pain for really more than a couple weeks, you really have to start thinking about having them evaluated by a medical professional, a physician, because it's not a completely uncommon phenomenon to actually have a fracture. Fracture I'm talking about is a fracture along the side of that spine, called a pars, and it's particularly vulnerable in the growing spine. So a lot of our growing athletes who are at the peak of their sport, as well as at the peak of their growth, are particularly vulnerable because the bone as it's growing is not as strong as a mature bone. And so they are very vulnerable. And in particular in certain sports, we see this a lot in baseball. We see it a lot in our rowers. We see it in our lacrosse players where there's a lot of repetitive motions, particularly extension moments, moments when you're going backwards and doing a lot of throwing or our gymnasts who do a lot of back bends. There's a lot of repetitive stresses on the back. And so we do want to catch those early if we can, so that we can allow those bones to heal with rest. The sooner we get to it, the sooner they can really rest and heal, so that they don't have any long-term effects of the fracture going forward. Less common in the young person, more common in the older person, older athlete, I mean athletes over the age of 20, so I'm not talking about very old athletes, is the herniated disc. So they're not that common in the teenage group, but maybe in our 20s and 30s, a little bit more common. And Dr. McInerney was talking about that disc. That herniated disc is really our shock absorber. And it absorbs a lot of the forces of gravity and jumping and running. And so they can get injured, and when they do herniate or bulge out, that bulging can irritate, sometimes can irritate the nerve, and that's when some people may, if they get a herniated disc, may notice they get pain that shoots down into their legs or into their buttocks, and that causes tingling or numbness. Again, that's something that you want to get evaluated by a physician fairly quickly. So why is the spine particularly vulnerable to injury? It's at the center of our body, and the motion begins at the spine. So if you think about any of our sports that we participate in, it's all motion that begins at the spine and then moves from center to outwards. And our athletic motion really relies on the stability of our spine. Oftentimes I see athletes, and they've got some of these athletes that come in injured, and they've got really strong arms and really strong legs, but if they don't really have a strong center, that's when they're very vulnerable to injury. And they're also not optimized in terms of their in terms of their excellence. So we really need these muscles to provide the scaffolding for our spine. So these muscles that you see at the bottom of the slide there are some of the essential core muscles. And we hear a lot about core muscles these days. These are the core muscles that help provide the scaffolding for our spine. So we build that muscle all around that spine to protect the motion, so that the forces that we put on it by jumping, running, throwing are absorbed by our muscles, which are meant to take that dynamic force. And so we aren't getting the repetitive forces on the bones, which really don't respond to those high impact forces as well as the muscles do. So not to scare anybody about using the weight room or, you know, sports in general in terms of the back, through studies, we've seen that with proper oversight and technique. So if we have good trainers and good education on proper techniques in the weight room, the risk to the injury, risk of injury to the adolescent athlete is actually quite low. So I think really the key is learning what muscles need to be engaged with each particular exercise, and why that muscle is so important to what the athlete is going to be doing in life and in the sport. Most of the time when we do see injuries, it's because of loss of form. So if they're not aware of how to do the exercise properly, or sometimes it's because they're trying too hard to keep up because they were given you know, a weight that was maybe too advanced for them. That's also a very common source of injury. So there's a lot of things within the weight room that can be used. You have the Nautilus type equipment with the handlebars, which are fixed equipment. There's the free weights, and they all have their uses and they all have their benefits. But the most important thing really is to know how to use the exercises effectively. We can get so hung up on fancy equipment and then forget about really the purpose of what muscles you're trying to work out. So I always tell my patients that it's important in the weight room that you know why you're doing the exercise, and if you have the benefit of having a good trainer, also ask the trainer why that muscle is in particular important to your motions and your sport. So with that, I'm going to hand off to Max.
Perfect. Oh, this is, yeah. So perfect. So we learned the anatomy. We learned about the common different injuries that happen along, and why support around the spine is very important. So now once we step in the weight room, some of the common things that we tend to see, some of the common faults that happen during the weight room can be whether you have excessive rounding through your back. And this is sometimes like when you're picking up a deadlift or when you're going into a squat position, where you kind of like really have that hunchback type of position, and that's because you're not really aware of what your movement mechanics look like. Well, you can also have excessive arching of the back that also increases the amount of stress that you're putting into your lower back. So if I don't have the movement capabilities to get a dumbbell overhead, if my shoulder range of motion just goes up to here, in order for me to get the rest, I have to arch in through my lower back. So sometimes that can also be due to limitations that the body has that you have to take care of before you actually start going into some of these type movements. Another thing we also tend to see is when the individual starts to utilize a lot of momentum, when they're lifting the weight and just utilizing as much force as possible, not really, like Dr. Chan said, focusing on developing that muscular awareness, utilizing the core as a dynamic stabilizer. So you're always focusing on engaging the core throughout, and then also utilizing your hips for support, okay? So from there, the next thing, we have to also be aware, like, what is the appropriate exercise progression? we first start out by mastering movement patterns. This, in order for you to master movement patterns, you have to have an adequate level of mobility. So when I say mobility, this means that adequate level of movement around a joint, or stability. So for example, if I have mobility for my shoulder joint, stability for my rotator cuff. So the rotator cuff helps keep my joint in a stable position as I bring it overhead. Also, as you're performing these exercises, maintaining a neutral spine. You want to make sure that you're not, like I said, excessively arching or excessively rounding the back, but then also focusing on control and then muscle awareness. Always, if you're performing an exercise, making sure that you got a slight brace through the core and that you're moving through the right movement pattern. And then ultimately, a lot of kids also forget, a lot of athletes, they focus about just going through the motions, but then also they don't really focus on their breathing mechanics. So sometimes learning how to brace the core properly, how to breathe out as I come out of the movement is also going to be very important. And then lastly, we want to make sure that we master body weight exercises before we start loading exercises, because if I'm already compensating while I perform a body weight squat or a hinge time movement, I'm going to compensate even further or put excessive stress on unwanted parts of the body once I start to load that movement. So when we talk about proper movement mechanics, we talked about maintaining a neutral spine, focusing on engaging the core. We're doing this throughout every single exercise we do. Whether we're pulling, doing like something like on the ground, single arm rows, we're always focusing on maintaining a straight line from the head down to the heels, making sure that the core stays engaged throughout. Same thing when I'm doing push-ups and stuff like that. A lot of the times where you'll also see that excessive arching again, like I'm going down into the push-up, you'll see kids, you'll see athletes where they're kind of like leading with their hips and they have an increased amount of arch through their lower back. So trying to maintain a neutral spine through every exercise that you do. Even like I said, that while you're building mobility and stability, you're also going to be able to have that support and that range of motion movement, so we're not compensating by going into the lower back, okay? So what do we need to do? We need to build a solid foundation. We start out with the exercises on the left before we go to the exercises on the right. So we start out by developing the core. The core is developed at a 360-degree aspect. So we're building the front side of the core through planks, side of the core, lateral planks. But then we do these exercises before we progress to more advanced exercises. These exercises on the left can also be regressed further as well. The biggest thing here is, as you see the picture of the individual in the picture, she's focusing on maintaining a neutral spine through a static portion on that left side, and also while she's doing the dynamic portion on that right side. So as we develop the foundation, we also have to, we focus on developing the front of the core, the lateral aspect of the core, but then also being able to resist rotation, right? So we have on the left side, the individual in a half kneeling position where he's learning how to utilize the core to resist rotation before he goes into actual rotation. So like Dr. Chan said, you have to be able to utilize the core to transfer energy, but I have to be able to develop that awareness first before I'm able to actually utilize such. And then lastly, we also know the importance of the hips. So in here, the hips are going to help allow you to give you more support when you're also performing the movements, but then also developing the posterior aspect of the chain, okay? And then with all of this, how do I warm up before I weight train? Sometimes individuals or kids or athletes usually just go into the gym and they go right, they're about to squat, and they go right into the squat rack, but then you'll know, like maybe all day you spend behind the computer, especially now with what's going on. We're doing a lot of work from home and stuff like that. We're spending a lot of time sitting. So your body's already gonna have some restrictions there. Before you start working out, you wanna make sure that you're increasing your movement by including exercises such as foam rolling, also so dynamic stretching, just so that you're able to get into better positions. And then after I get into better positions, now I have to prepare my body to be able to handle load by doing exercises that increase my stability or increase my support, but then also kind of like tell my body like, hey, I need my core to start being engaged. I need my hips to start being engaged, but then I also need my rotator or my shoulder blade muscles to start being engaged before I start loading these movements. So stability or activating, or sometimes they say firing muscles before actually going into the like heavy lifting is going to be very important as well.
Great, that was really fantastic. I think we'll move into the question portion of this. I don't see any questions in the chat room. So Dr. Chen, maybe I'll start with you. What types of injuries outside of maybe a pars fracture do you see most often that result from weight training?
Most of what I'm seeing is strains, and when I evaluate my patient, oftentimes what I see once I've ruled out things like a pars fracture or a disc pathology, is when I evaluate the patient, I watch how they move. Oftentimes I can see that what they're doing in the weight room or what they're doing out on the field is sort of beyond what their stability is. And so a lot of times it's the muscle strain and strains that are occurring because they're using improper technique or poor form. I see this a lot, and young people, especially if they're physically gifted, they can cheat a lot and still get away with it. I see it with my rowers, and they can have a lot of abnormal motions, and yet they can still be pretty successful in their sport at this young level, even though they're using their bodies inappropriately. And so what we see is a combination of poor form causing muscle strains and strains, as well as a lot of overuse, especially these days where the kids are so specialized and they're doing the same activity over and over. We're seeing some overuse. So muscles that are getting fatigued out because one direction is always being used and the other direction's not. I keep talking about the rowers. It's sort of fresh in my mind. I see rowers, and a lot of them are right side or starboard rowers versus port rowers, and so they develop muscular asymmetries, and they're very vulnerable to back injuries because of these asymmetries.
Yeah, absolutely. So how should a patient know when's the appropriate time to visit a doctor or a physical therapist? How do they know if it's something more than just a muscle pull? What would you recommend in terms of when they should seek, higher level of care?
For most of us as adults, a couple weeks in strains and should start calming down. Maybe they get a little bit better over a couple of days, but they linger for several weeks. And that's not so unusual. However, in our young patients, it's really not normal for young people, say 15, 16, 17-year-olds, to have, chronic back pain or to be complaining that their back aches all the time. You'll hear that in 40-year-olds, but you shouldn't be hearing that in 16-year-olds. So if you have a young patient or a young kid and they're complaining about pain that's lingering on beyond 2 weeks, I definitely would have that checked out.
Absolutely. Max, what are some things athletes can do to prevent back injury while weight training? And are there any specific movements or activities that you would advise them to avoid?
The biggest thing that they can do is really focus on exercise technique. So, but then also besides, before even starting to lift weights, can they really master their body weight before they actually start to load the system? In addition, do they have adequate mobility? Can they move their joints through adequate range of motion? Because a lot of the times they may be doing like any sort of pressing, any overhead movement, the body's just going to compensate, and the body just automatically knows how to compensate, how to get the job done. So trying to make sure that if I'm going to be doing any overhead movement, making sure that I have adequate level of movement through my shoulders. And also, if I'm going to be doing any lower body, I have adequate level of movement throughout my hips as well. Activities that they should avoid, I mean, anything is going to be safe as long as they're following proper progression, right? There's no specific activity that they're going to, like one thing that the lower back, especially as we go into sport like lacrosse, tennis, and anything like that, anything where they're already like putting their spine into a high amount of stress by going into extension and rotation, they're doing this so often during their sport that maybe once they go into the weight room, they can start to just focus more on anti-rotation and developing that core just a little bit further. And then maybe not including stuff like a Russian twist and stuff like that, or stuff where they're not really able to get that form done correctly, where they're really compensating through their back. But then, like Dr. Chen said, making sure that they develop that muscular awareness. A lot of athletes go into the weight room and they just like start picking the weights up, and they're like, I don't really feel anything working. Or the next day they may say like, oh, I feel this kind of hurting over here. So making sure that if I'm doing a squat, I'm focusing on my core, but then I'm also focusing on my hips. But then I'm also focusing that to make sure that I have adequate movement capabilities as well.
That's great. Dr. Chen, you alluded to this a little bit, especially in the setting of early single sport specialization. Can you talk a little bit, both of you, about the importance of athletes doing cross training as a means of trying to avoid sustaining an injury?
Yeah, I think it's so important, especially with a growing athlete, that they do a variety of motions. Our bodies were meant to do lots of different things, and that's why we have such flexibility in our shoulders. That's why we have flexibility in our hips and our knees and ankles, is to allow us to do all these variety of motions. And when we sort of pigeonhole ourselves into one directional movements over and over again, we get an imbalance of muscles, and with that imbalance, oftentimes you get, poor balance in general, and that oftentimes leads to injury. So, even if the child has one specialty sport, I think it's important then that built into the training of that sport has to be a balance of trying to balance out, if the lats are very important in this particular sport, that we also balance out by making sure that the lower abdominal muscles are engaging properly and the back muscles are engaging. If you have a sport where throwing is so important and they're all focused on the upper body, and we don't pay attention to the lower legs, the quads and the glutes, they're going to burn out and throw out their shoulders if they don't have that stronger lower core. And that's why it's so important that they do a variety of sports. And it's also important, I think, for their mental health too. We get these young athletes that are, so superb in their sport, and then emotionally they can burn out if they feel like they've become pros too soon, I guess. So I think for a variety of reasons, it's really important. I think, one, it's important because humans are meant to move in lots of different ways. And secondly, it's good for our emotional health. And third, it's important to avoid injury.
Yeah, absolutely. I think that's a really important concept that all young athletes should take to heart. So given sort of our limitations right now with not really having access to gyms, Max, can you recommend some safe weight training exercises that people can do at home while avoiding injury?
Perfect. The safest weight training exercises that someone can do at home is just going to be a body weight exercise. So can they master? So this is the perfect time where you're able to be at home and then really master your mechanics, right? But then also try to work around like any movement limitations that you may have. So anything sort of like doing the like I showed in the previous slides, like working through those planks. Can I hold a plank for 30 seconds while maintaining a neutral spine? Side plank, everything that's going to help me develop a well-balanced core so that I'm able to transfer that later on to where I'm starting to add some load as well. Can I perform a squat movement with proper mechanics? Can I start to go through a hip hinge or moving through my hips without rounding through my back before I can actually start to load those movements? So the best exercise is going to be a body weight exercise that they can start with at home.
Great.
And actually, I would add to Max's point that a little bit of training, you can even do training virtually now. And I have written prescriptions for physical therapy to be done virtually, or have patients work with the trainer, because so much of what Max is talking about can be done with coaching virtually. And, our athletes are pretty in tune with their body. They can get a lot out of a virtual visit. from where Max is starting, you can continue to progress upwards. I just yesterday was telling a patient who swore he was not going to be able to get any benefit unless he was in the gym in a weight room, but couldn't actually stand on one leg without tipping over. You know, there's a lot of different ways that you can get benefit without being physically in a weight room, with like the exercises Max was talking about.
Yeah, I think that's a great addition, Dr. Chen. Well, I'd like to thank both of our panelists today, Dr. Chen and Max, for taking the time. That is all the time that we have for today. Thank you again for tuning in. And if you have any questions or would like to learn more about Hospital for Special Surgery, please feel free to comment below or visit hss.edu. And please tune in for next week's TMT topic, staying safe, helmets, concussions, and protective equipment. Thank you for joining us.